Dr. Eleanor Vance, a respected cardiologist at Bayview Health Center in Springfield, has recently provided valuable insights for her senior patients about how certain fruits can affect heart health. While fruits are a cornerstone of a balanced diet, particularly for older adults, she emphasizes that some fruits can actually pose risks when consumed in excess, especially for individuals over 50 or those managing health issues, like high blood pressure or kidney disease. It's not about cutting these delicious fruits out of your diet entirely, Dr. Vance explains. It's about making informed choices, being mindful of what you eat, how much of it you consume, and when you eat it can significantly impact your heart health. According to Dr. Vance, there are 5 fruits seniors should approach with caution. Each has unique nutritional attributes that can either support or potentially undermine cardiovascular wellness when not consumed appropriately. 1. Bananas. Bananas are well known for their high potassium content, which is essential for heart muscle function and maintaining a healthy blood pressure. However, for seniors, especially those with compromised kidney function or those taking ACE inhibitors or other blood pressure medications, excessive potassium can accumulate in the bloodstream, resulting in a condition called hyperkalemia. This condition can lead to irregular heartbeats and, in severe cases, may cause sudden cardiac arrest. Dr. Vance strongly advises limiting banana intake to half a banana at a time and pairing it with a high-fiber food like oatmeal. Overripe bananas contain higher amounts of sugar and should be avoided, particularly for those with blood sugar issues. Eating them with fiber-rich foods helps slow down sugar absorption and prevent sharp spikes in blood glucose levels. Additionally, people with diabetes or prediabetes should be particularly careful with banana consumption. The fruit's natural sugars can be metabolized quickly, leading to a spike in blood glucose that's difficult to control without medication. Keeping banana portions small and pairing them with healthy fats or proteins such as a small spoonful of peanut butter or a slice of whole grain toast can make them safer for consumption. 2. Grapes. Grapes, while convenient and tasty, are high in fructose, a type of natural sugar that becomes harder for the body to process with age. As metabolism slows, the body may struggle to convert fructose into energy efficiently. Instead, it often converts the excess into triglycerides, a form of fat that can accumulate in the blood. Elevated triglycerides are a known risk factor for atherosclerosis, a condition in which fatty deposits build up in the arteries, restricting blood flow and increasing the chances of heart attack or stroke. Grapes also have a high glycemic index, meaning they can cause rapid increases in blood sugar levels followed by sudden drops, which can leave you feeling fatigued and even dizzy. Another important consideration with grapes is their impact on hydration. Grapes are high in water content, which might seem like a benefit, but in seniors with compromised kidney function, excessive fluid intake, especially when combined with certain medications, can exacerbate water retention or electrolyte imbalances. It's best to consume grapes in moderation, preferably in combination with other low-sugar fruits. 3. Watermelon. Watermelon is a refreshing summer fruit, but Dr. Vance cautions seniors to limit its intake. Watermelon contains citrulline, an amino acid that causes blood vessels to dilate. While this may be beneficial for some people, for older adults taking medication for high blood pressure, it can lead to an excessive drop in blood pressure, causing dizziness or even fainting. Additionally, watermelon has a glycemic index that ranges between 72 and 80. This means that it can rapidly raise blood sugar levels, which can be problematic for those managing diabetes or insulin sensitivity. These spikes may also lead to heart palpitations or unstable heart rhythms in sensitive individuals. Moreover, watermelon's diuretic properties can lead to increased urination, which may be concerning for older adults who are already on medications that affect fluid balance. In some cases, this can cause dehydration or a drop in electrolyte levels, leading to muscle weakness or lightheadedness. A small serving of watermelon enjoyed with a protein-rich meal may reduce these risks. 4. Durian. Often referred to as the king of fruits, durian is exotic and aromatic, but it's not ideal for seniors concerned with heart health. Durian is surprisingly high in both sugar and saturated fat. Saturated fats contribute to the buildup of LDL or bad cholesterol in the blood, which can then form plaques in the arteries. These plaques reduce blood flow and can lead to serious cardiovascular events, such as strokes or heart attacks. The combination of sugar and fat in durian can also raise body temperature and increase heart rate, placing additional stress on the cardiovascular system. Dr. Vance urges seniors with existing heart conditions to consume this fruit sparingly, if at all. In addition to its nutritional concerns, durian may also interact with medications. Some compounds in durian can inhibit enzymes involved in drug metabolism, potentially making certain medications more potent or less effective. Seniors taking heart medications, diuretics, or blood thinners should consult a healthcare provider before consuming durian.5. Mangoes are sweet, flavorful, and packed with nutrients, but they can also be deceptively high in sugar. A single ripe mango can contain the sugar equivalent of about 10 to 12 teaspoons of refined sugar. For seniors, particularly those with insulin resistance or prediabetes, this poses a serious concern. Excess sugar consumption can impair the body's insulin response and promote the formation of triglycerides, further contributing to arterial plaque buildup. Moreover, consuming mangoes in the form of juices or smoothies eliminates most of their fiber content. Without fiber, the sugars are absorbed rapidly, similar to drinking a soda, which can lead to sharp increases in blood sugar levels and additional cardiovascular strain. Dr. Vance recommends that seniors eat mangoes in small slices, paired with a source of healthy fat such as avocado or a handful of unsalted nuts. This not only slows the sugar absorption, but also supports more stable blood glucose levels. Avoid canned mango products or those preserved in syrup, as these can contain added sugars that further elevate health risks. Dr. Vance's 5 rules for heart-friendly fruit habits, though, help seniors continue enjoying fruit as part of a heart-conscious diet. Dr. Vance offers 5 essential guidelines. 1. Mind your portion size. Instead of eliminating these fruits completely, control your portions. Eating smaller amounts can help you benefit from the nutrients without overwhelming your system with sugar or potassium. Being mindful of portion size also allows for greater dietary variety. By limiting high-risk fruits to occasional, small servings, you create room in your daily diet for a wider range of vegetables, legumes, and whole grains, all essential for long-term cardiovascular health. 2. Don't eat fruit on an empty stomach. Consuming fruit after a balanced meal slows down the absorption of natural sugars, making it easier on your digestive system and reducing the risk of blood sugar spikes. The strategy also reduces the likelihood of reactive hypoglycemia condition, where blood sugar drops too quickly after a spike, leading to symptoms like shakiness, irritability, and fatigue. Pairing fruits with foods high in protein, fiber, or healthy fat further enhances the benefits. 3. Skip juices and smoothies. Though convenient, fruit juices and smoothies often lack the fiber found in whole fruit. This causes sugars to enter your bloodstream more rapidly, leading to sugar spikes that can strain your heart. It's also easy to consume far more fruit than intended when drinking smoothies or juices. A single glass can contain the juice of multiple pieces of fruit, far more than you'd likely eat in one sitting, thereby intensifying the sugar load on your body. 4. Prioritize heart-friendly choices. Select fruits that have a low glycemic index and are rich in antioxidants. Some of the best choices Dr. Vance recommends include apples, blueberries, strawberries, grapefruit, and pears. These fruits support cardiovascular health without overloading your system with sugar. Fruits like berries are especially beneficial because they're also high in anthocyanins, compounds shown to improve blood vessel function and reduce inflammation. Regular consumption of these fruits has been linked to lower blood pressure and reduced risk of heart disease. 5. Listen to your body. Everyone reacts differently to different fruits. If you notice fatigue, palpitations, or other unusual symptoms after eating certain fruits, take note and consider limiting or avoiding them. Keeping a food journal may help identify which fruits affect you negatively. Listening to your body also means noticing subtler signals, such as digestive discomfort or changes in sleep patterns. These may indicate that your body is struggling to process certain sugars or that your fruit intake is interfering with your medications or digestion. In conclusion, Dr. Vance's advice underscores the importance of being proactive and thoughtful when it comes to diet, particularly for older adults managing chronic conditions. By making small adjustments and staying informed, seniors can still enjoy a variety of delicious fruits while protecting their heart health. Making informed decisions today can lead to a longer, healthier life tomorrow.